Hello, I'm Dr. Megan Mello. I'm a family and obesity medicine physician in Seattle, Washington, and today I'm coming to you to talk about insulin resistance and why it matters. Now, insulin resistance is something that is considered to be very important when it comes to weight management, but it's something that most of us haven't heard or learned very much about, including physicians and other healthcare professionals. It certainly wasn't something that I learned about in medical school and had to come across much later, but it's a really important component for many of the patients that I see who are struggling with their weight, and we are worried about their metabolic health. Now, not every person who has been struggling with their weight has metabolic problems, but a fair number of them do or are at high risk for them. And insulin resistance is really one of the most important ones. So we're going to dive in today. What is insulin resistance? It's really important to understand some of the mechanics so that we can understand why it's a problem and what we need to do to fix it. In today's food culture, we have an abundance of processed carbohydrates. That includes starchy foods and sweet foods. Think about breads, pasta, rice, things made from flour, as well as sweetened items, right? And that includes things like cereal, pastries, cookies, cakes. We are surrounded by these kinds of foods in a way that we have not been before, right? We have an overabundance of these foods. These foods are not naturally bad and terrible, but the more refined our food is, the easier it is for us to digest. And unfortunately, the more palatable it is, the more of a dopamine hit we get from it, right? These foods are very, very rewarding to our brains because our brains are conditioned to like quick hits of sugar, right? If you have a sweet tooth, there's nothing wrong with you, but we are living at a time where we have so much sugar around us all the time, and it's becoming a problem. So when we look at insulin resistance, first let's understand what's going on with sugar and insulin metabolism, because again, that's maybe an area that you're not familiar with. When we eat any kind of food that is a carbohydrate, right, whether it's a starch or a sweet, we swallow the food, we absorb it down into our stomach, and it becomes processed in the intestines. When it hits our stomach and our intestine, the pancreas is triggered to release insulin. Insulin is a hormone that is secreted into the blood, and its whole purpose is to allow sugar absorbed from the bloodstream into the muscles. That is the purpose that insulin serves. It has a few other roles which are really important, but the idea is that when sugar is in the bloodstream, it needs something to help it get into the muscles to be used for energy. When we eat those foods and our body has broken down the foods into sugar molecules, again, whether it's a starch or a sweet food, that's what happens. Those sugar molecules go from the intestines and enter the bloodstream, and they travel through the bloodstream ready to be used as energy, but they need help in order to get into our muscles. And insulin is the help that they need. Insulin unlocks the door for sugar to move from the bloodstream into the muscles. Without insulin on board, sugar will just hang out indefinitely in the bloodstream. And that is a problem in type 1 diabetes, the more rare kind, where the body is not capable of producing enough insulin, and therefore blood sugars go very, very high. Now, that is a condition that often presents in childhood, and it's a separate issue from the more common type 2 diabetes, which is more of a health problem related to excess sugars and certainly genetics. But the sugar molecules need the help of insulin in order to get into the muscles to be used for energy. Now, the muscles need the glucose, they need the blood sugar in order to be able to function, right? In order to be able to have energy to move and get us throughout our day, or, certainly when we are exercising and active. But the muscles only need a certain amount of sugar. And when they get enough, they signal that the insulin is no longer going to be able to move it into the muscles. They say, we've had enough, and they self-protect from getting too much sugar, which is damaging to their cells. Insulin Therefore, then and sugar travel into the liver and they allow for storage of a relatively quick acting form of sugar to be stored in the liver called glycogen. So that when we are not eating, such as overnight, our body can release glycogen, which can be used for sugar, and we have access to the energy we need overnight when we're not sleeping or for longer periods of time, such as when we might be fasting or sick or some other condition where we're not eating regularly. So we have a mechanism to store that extra sugar, but again, the liver can only take so much. When the liver starts to be full, then the insulin is a signal to the fat cells that we all have in our body to take up the rest of the blood sugar, right? To take that glucose and to store it in the fat cells. So the fat cells can keep it as a long-term storage for energy. The fat cells are adapted this way so that humans could survive famine, humans and other mammals. So if we hit a period of time where we didn't have access to food for days or weeks, we have extra body stores in our fat that allows us to have the energy to survive, right? That's why we don't immediately die after a few days without food. We have some long-term storage. The problem is, and why this is so important, is because, again, we have so much processed carbohydrates right now, and most of us are overeating them, and our bodies are exceeding the capacity to effectively store this. Rather, they are effectively storing it, but they're storing it in a way that we don't like. They are not able to use up all the energy because we do not need that amount of energy quickly available. And so that goes into fat storage. So this is something, insulin resistance, right, where we have too much sugar in the blood. The muscle cells have gotten enough. The liver cells have, and the pancreas responds by continuing to secrete more and more insulin. That high insulin is often increasing our hunger signal, and it's increasing that fat storage signal. The fat cells have receptors for insulin, and when they see more and more insulin and they see sugar available, they are pulling that extra energy into long-term storage as more fat. Fat cells enlarge, fat cells multiply. They are sitting there just waiting for all that extra energy. When people are in insulin resistance, it's quite common for them to feel more hungry than they have been in the past and to be gaining weight or not losing weight when they are trying to make some changes. So perhaps they've reduced their calories, perhaps they're exercising more. Things that have worked for them in the past to help lose weight are often not effective because the fat cells are getting this extra signal to store extra energy as body fat and to hold on to it. Again, because the body doesn't know that starvation is not around the corner. When we have this excess of sugars and starches available to us, they are in highly concentrated forms that are very, very easily digested by the body and transferred into sugars. We are often running around with excess levels of sugar in the blood, excess levels of insulin, and for a while, the insulin is able to keep our blood sugars under control. This might happen for years. So people might come in to see me, they might be very hungry, they might be gaining weight, they might or not be able to lose the weight. And they may have been told before your blood sugars are normal, even though they have a family history of diabetes or some other risk factor. The body can stay in balance often for several years, but eventually that system tips and the body is no longer able to effectively clear enough sugar out of the blood sugars start to rise. This might be an elevated fasting blood sugar. It might be an elevated average blood sugar, a blood test called hemoglobin A1C, or it might be both. And when we have those abnormal blood sugars that are in a relatively low state, so they're not at the level of diabetes, that is a state that we often call pre-diabetes. So insulin resistance often comes first. Insulin levels will be elevated compared to glucose levels. Then maybe after years, we get to a stage where that system falls out of balance, and then we might have elevated insulin levels as well as mildly elevated blood sugar levels. And if nothing changes over time, this nearly always progresses into diabetes. Unfortunately, we are seeing this more and more, and we're seeing it at early ages. So whereas type 2 diabetes used to be something that people would experience later in life, in their 40s, 50s, 60s, and beyond, we are now seeing this at far younger ages. And it has to do with the rise of very highly processed carbohydrates that are cheap, easily accessible, easy to overeat, all of these factors, right? And we crave them. Insulin resistance and a relative food addiction probably go together. So let's talk about how we might check for insulin resistance. This is not something that is routinely screened for in most of the blood panels that might be done for somebody coming in for weight loss or someone coming in for a routine physical, right? And they might mention to their doctor, I've been gaining weight, I've been trying to work on it, but nothing seems to be happening. Because most physicians and healthcare professionals have not learned a lot about insulin resistance, they aren't trained to screen for it. They are trained usually to screen for diabetes, and so they may ask for fasting blood sugar. They may ask for hemoglobin A1C, which is a measurement that checks your average blood sugar for the past 3 months, but they typically aren't checking a fasting insulin level. Checking a fasting insulin as well as a fasting blood sugar as well as a hemoglobin A1C is a great first step, but you may need to ask your physician for it. Checking the fasting insulin to glucose ratio is a score called HOMA-IR, HOMA-IR. And this is a measurement of insulin resistance. It's not the only one that's available, but it's the relatively easy and straightforward way to see, do you have a high insulin to blood sugar ratio, which indicates that you are in that insulin resistance state. This is relatively easy to screen for. It's relatively low cost, but it's an important piece of the picture when we are talking about trying to help with weight loss and managing metabolism to prevent diabetes. After we have found that someone has insulin resistance or, certainly, is worried about it, perhaps has a family history of diabetes, maybe has had gestational diabetes with a pregnancy before, it's important that we move on to next steps. What do we do about it? The most important first step is to look at the current foods that you're eating, right? And I'm going to call that a diet because I'm not talking about a weight loss specific diet here. I'm just talking about the word diet to describe the foods that you currently eat. Write down some of your average meals, what you typically eat in a day, and the relative sizes of them. When you look at this, how much of your meals is coming from carbohydrates? And again, that includes breads, rice, pasta, potatoes, sweets like cookies, soda, candy, pastries, even relatively healthy grains like oatmeal, certain other whole wheat, or whole grain sort of foods. They are also carbohydrates. They are usually better carbohydrates for you to be eating because they won't have quite the same blood sugar effect, but they're still carbohydrates. And so we still need to look at the overall amount that you're eating as well as the quality of them. The more processed and refined your carbohydrates are, so the more that you are eating things that are made from flours or processed sugars, often the higher the impact that's going to have on your blood sugars, as well as probably more addictive overall. We need to reduce the overall amount, and that can include reducing the number of carbohydrate servings that you eat per day, as well as how often you're eating them. So that's the number one place for us to start. I don't advocate for a keto diet for my patients, which completely eliminates carbohydrates. I think that's too restrictive. And whatever we do to lose weight or manage our metabolism, we need to do for the long term. We don't just fix this problem and it's never a problem again. It's something we need to manage for the long term. So I want people to come up with a way of eating that works for them long term. but reducing carbohydrates is always going to be a part of that. Increasing our protein and our plant intake. And by plants, I mean real fruits and vegetables. Yes, it's true that wheat is a plant, but the wheat that we typically eat is highly refined in the form of flour that is made into other baked goods, right? We want to minimize the amount of very processed carbohydrates and think about more whole foods, more fruits and vegetables, more healthy sources of protein and healthy fats, less of the carbohydrates. Another thing that may be important for you is decreasing the frequency with which you eat. Some people are eating breakfast, then a snack, then lunch, then they're munching on stuff in the afternoon, they're eating dinner, maybe some drinks before dinner, and then they might be snacking late at night. Now, that's certainly not the pattern for everyone, but if you are eating that frequently, you are naturally going to have higher insulin levels kind of all throughout the day, because especially whenever you're eating carbohydrates, you're going to release more insulin at that time compared to when you're not. So look at how often you're eating as well, and we can talk about that. Sometimes people also will consider using a blood sugar meter. Now, traditionally, we've used these for people with diabetes, but they can also be used by people who don't have diabetes but might be at risk for it, and they want to measure the effects of certain foods on their own blood sugars, kind of as a proxy for seeing how is my body doing with relationship to these carbohydrates. If you check your blood sugar after eating a slice of white bread, compared to after eating a slice of a whole wheat bread, you may see a difference in terms of your blood sugar response. If you add peanut butter or some other kind of healthy protein and fat to that bread, you will also probably see a difference in your blood sugar. You might see more of a blood sugar spike with a fruit like a banana, which has less fiber, compared to eating some berries, which tend to be a good high fiber source. So sometimes people really love this data. They love to be able to see, when I eat this, my blood sugar tends to go way up. When I eat these other foods or eat these foods together, when I combine fruits with proteins and fats like some nuts or some cheese, then I see less of a blood sugar spike. This can be helpful information for people, again, who really like that data to be able to help guide their eating choices. So those are just some of the things that we do when we see insulin resistance as a pattern. As an obesity medicine physician, I also talk to my patients about potential medication options. When we are looking at this pattern, sometimes people might be doing all the right things in terms of their nutrition and their activity. They might be moving regularly, they may be following a relatively low carbohydrate, but their body is still struggling. When that happens, again, we talk about different medications options, and that can include medications like metformin, as well as the anti-obesity medications Wegovy and Zepbound, which are the weight loss versions of diabetes medications like Ozempic and Mounjaro. These medications also help to reduce insulin resistance, and they can be an important tool in assisting with weight loss and metabolic management. I hope that this has been a helpful discussion for you to think a little bit about insulin resistance. If you are struggling to lose weight despite doing all the right things, if you don't know where to get started, if you have a family history of diabetes, if you've had gestational diabetes, if you have pre-diabetes, these are all important considerations for changes that can be made in order to help prevent diabetes, help you reach a healthy weight, help you get to a healthy metabolism pattern that works for you, prevents disease, and makes you feel good. If you are living in the Seattle area and you're interested in coming to work with me, please reach out to us. I am at Finney Primary Care and Wellness, www.finneypcw.com. All right, thanks and have a great day.